everybody, Dr. Nayo here again with Rupa Health University. So today we're going to talk about intestinal parasites. So this is something that a lot of people get curious about, a lot of people suspect. So I want to give you an overview of what a functional medicine provider is thinking about when they're assessing for parasitic disease and how they would go about managing it if they were to find a parasite. So let's get into it. So the first thing I want us to do is to center ourselves so that you can receive and assimilate this information even better. So let's center our attention at the center of our chest and take a nice deep breath, tracing it in and out of the center of your chest. Now keep your attention there while you're tracing that breath. And then lastly, bring into something into your mind that makes you smile, like a sunset, a sunrise, being at the beach, playing with your kids, while continuing to trace your breath in and out of the center of your chest. Keep going for 2 more rounds, in and out. 1 more. Perfect. So why did we do that? So that actually put your system in a coherent state where the heart is now driving your biology and your brain is now taking orders from your heart. And so you're in what's now a coherent state, which makes you more receptive to receive information and assimilate it. And then hopefully also helps to create more of a healing state within you. All right, so now let's get into talking about parasites. So what exactly is a parasite? So just think of a parasite as an organism that is growing in or on another organism, which we would call the host. And it may be deriving nutrients from the host or reproducing on or in the host, and sometimes at the expense of the host, but not always. So that's the basics of what a parasite is. And specifically today, we're going to talk about intestinal parasites, but here's a few common parasites that you may have heard of over time. So ticks, worms, fleas, and lice. What I really wanted to speak about is to the point that not all parasites are always detrimental. And in fact, they actually have played a key role in the development of a healthy immune response over time in humans. So it's not always going to lead to a negative consequence. Now, with that said, I'm not saying not to treat a parasite that's found or if you're suspicious to ignore it, but it's just some context for you to know that sometimes there is more of a symbiotic and not a detrimental relationship to the host. So one key example are Helminths, which are worms, intestinal worms, and they've been known over time to really play a key role in helping human beings to develop a really robust immune response so that they don't see bacteria or other foreign organisms or bodies as a problem. Your immune system is strong enough to actually deal with them. So let's talk a little bit more about what this looks like. One of the aspects of our immune system is called the cell-mediated immune response, and that is derived and utilizes T helper cells in part. So we have 2 types of immune responses within that called the T helper 1 response and the T helper 2 response, so Th1 and Th2. We need balance between these 2 branches of this part of the immune system in order to support a robust, healthy immune response. And so one of the reasons that we may be seeing more autoimmune disease outside of, we're just more disconnected, more stress, which is really biggest driver of that. The other aspect of it is that if our immune systems do not have balance between these 2 branches of the cell-mediated immune system, you can actually create more imbalance and therefore disease. So for instance, people who have been exposed to parasitic worms or had an infection, they actually develop a more robust T helper 2 or Th2 immunity. And what can happen though is if you have imbalanced more T helper 2 humoral response, that actually can support more atopic or allergic disease if you don't have it balanced with the T helper 1 response. However, those people who are exposed to parasitic worms, they're less likely to develop autoimmune disease. So that's like your rheumatoid arthritis, your Crohn's, your celiac, things like that, Hashimoto's thyroiditis. So you're less likely to develop that because the part of your immune system that's weak is going to lean more to an atopic and allergic response. So that's like environmental allergies, eczema, things like that. So you can see it's not we one over the other. We need a balance. And if you lose the T helper 2 response, it can be the result of us living in a more industrialized, over-sanitized world where there's, somewhat of an obsession on protecting ourselves from something external. So like the antibacterial wipes, the antibacterial soaps, etc. Rather than just good hygiene, we're focused on actually going after and kind of wiping bacteria out, but that also, wipes some of our immune response out as a result. So that's one thing that we think that's going on. Now, conversely, you can also have an imbalanced T helper 1 or Th1 immune response. And if that happens, so you have more of the T helper 1 immune response, you're more likely to develop autoimmune disease and infections. And then you're less likely to develop that atopic and allergic disease. So it's not, again, I said this 3 times, I think now, it's not one versus the other. It's the balance between the two that's going to support you having an optimal immune system and immune response. So it's very important to kind of have everything in contact. What are some of the common ways that someone may be exposed to a parasite that they may be unaware of? So a common way is consuming contaminated food or water that has some of the parasites in them. It's a fecal oral transmission. Poor hand hygiene, also fecal oral, which means basically what I'm saying when I say fecal oral transmission is that it's coming from parasites usually that are in somebody's stool, and that is in the water supply that then can get in the food supply and the water supply. And then that's the way that it's transmitted. But you can also have it from swimming in contaminated lakes or pools. So that may be where waste is inappropriately dumped in lakes or pools. It could be that it's not properly treated to keep the balance of what's growing in the pools. Can also be actually direct contact with human or pet waste. Someone who has an immune system defect or weakness can be one of the ways, and specifically secretory IgA is our first line of defense. So it lines all of our mucosal surfaces. So your nose, mouth to anus has IgA because it's your first antibody that helps to address, from an immune perspective, anything that's coming into your system. So if this part of your immune system is weakened, that could be another possibility that makes you more susceptible. And then low stomach acid. So one of the reasons we have a very acidic environment in our stomach is because that's the first place that organisms kind of can come in contact to your GI system. And therefore, that's a very acidic environment can help to neutralize and kill some of those organisms. So these are some possible routes of transmission of or development of exposure to parasites. Also, people often, will ask, well, how do I know if I actually am likely to have been exposed to a parasite? It's not necessarily very specific, but some of the things that a functional medicine provider is going to be assessing for is an anemia. So that can be one of the first things that we see when we're looking at your complete blood panel. Your CBC. Fatigue could also be a major sign or symptom. We could see weight loss, and that's because the parasite is actually getting a lot of the nutrients and you're actually absorbing them and utilizing them, so you actually lose weight. You can have a change in your appetite or satiety, which means you feeling full after a meal. This is a big one. You can start to see nutrient deficiencies, again, because the parasite can be utilizing them instead of you getting them for key functions in the body. From a digestive standpoint, you could have acutely abdominal pain, constipation, diarrhea, bloating, and gas. So sometimes these people will be given a diagnosis of IBS. You can also have what's commonly referred to as traveler's diarrhea, and that's usually more acute. So you've been traveling somewhere abroad where maybe the sanitation has not been as great, and therefore you immediately develop diarrhea. You can also develop skin rashes and eczema, and this is, again, mostly because think of the skin as an extension of your immune system and digestive tract. So if something is going on in one or both of those areas, which usually it's both, then you can actually see manifestations in the skin or on the skin. You can also see sleep disturbances, anxiety, joint pain, and then mast cell imbalance is something that we can see. And that's typically a histamine-mediated immune response. Some of those signs and symptoms are urticaria, which is commonly referred to as hives. So you get those little blips that are an allergic response. It's like a little welt that swells. You can also get anorectal itching, so itching in the rectal area. Can also get itching on the soles of your feet and palms. So these are some of the common things that we would be asking if there's possible exposure to a parasite. So how do we diagnose parasites? Let me just say, if you just go to a conventional PCP, they can sometimes catch it on a conventional lab's microscopy test. So it'll be called an ONP, an ovine parasite microscopy test, which is when somebody's looking under the microscope to assess to see if they see either eggs or the parasites themselves. The issue with this is they aren't necessarily having a high volume of seeing these tests, and so sometimes things can be missed. The other thing that can be happening is if it's only a one-day specimen, that you can miss it because you're only getting one stool that you're actually assessing. And then there are other modalities that we're going to go over that can actually help us hone in and have multiple ways of looking for organisms. So most people who are in this conversation and listening to this video, they're actually going to be working with a functional medicine provider. That provider is actually going to ask you about your travel history, especially if you've been somewhere where parasitic disease is a little bit more endemic. And they're going to ask you about other possible routes of exposure that you might have had. They'll think about doing stool testing as well. So that's important. And we'll go into that in detail in a minute. And then blood testing is another common way that sometimes even before we get to stool testing that a doctor can pick this up or a provider can pick this up. So one common thing that we'll see with parasitic infections on your CBC, your complete blood count, we'll see high levels of eosinophils. So eosinophils are white blood cells that tend to deal with more allergic response. And so parasites tend to simulate that. So when we start to see a high level of eosinophils in the context of you having some of those symptoms that we just mentioned, that would be a clue to us to think about parasites. Also, I mentioned at the start, anemia, and specifically an iron deficiency anemia, can be common. And again, the organisms are deriving and utilizing some of your nutrients so that you don't get them. And therefore, you could develop an iron deficiency anemia. And then similarly, B12 deficiency also could happen. Same mechanism, the organism's getting and utilizing the nutrient instead of you. And therefore, you show up with your blood test with a very low B12 level. Sometimes it's usually not the first thing that we're going to start to do as a functional medicine provider when we're thinking about parasites, but micronutrient testing also could reveal some of these deficiencies and more. When we start thinking more specifically about working with the functional medicine modalities, some of the stool testing options that we'll see, we're usually going to use in combination, but I'm going to go through them. So an ONP analysis that uses microscopy, which is looking under the microscope for ova, which are eggs, and parasites, which are the actual organism once it's developed. The reason you want to use a good functional lab this is what they're doing all day, every day, is because they're more keen to be able to pick up on these subtleties and that it won't be missed. So that is one aspect of functional stool testing, ONP microscopy. EIA antigen testing is actually another modality. We can also look at actually culture the stool for organisms and do PCR. So I'm going to talk about that in a minute. And then something that be coming in the future is metagenomics, which is another way we could screen for parasite. Okay, so what are common parasites, and specifically intestinal parasites, that your doctor may be looking for? So we have Blastocystis hominis, Giardia, Entamoeba histolytica, Cyclospora, Entamoeba fragilis, Ascaris lumbricoides, Trichoceros trichuria, hookworm, Toxoplasma, Cryptosporidium, and Helminths worms, which I mentioned earlier. So we go through some of the more common ones that a functional medicine doctor is going to be assessing and that is likely to pop up on the functional stool analysis. So Blastocystis hominis is a parasite, and it has 17 subtypes. Not all of them affect humans, we believe at this point. So it's just a subclass of them that likely affect humans. So, but it may be associated with travel in these less sanitized areas or people working with animals. And common signs and symptoms are having more of a watery diarrhea. So you'll still see stool, but there's a lot of water in it because you're not absorbing it as a result of the organism. Nausea, abdominal pain, bloating, excessive gas or flatus, loss of appetite, weight loss, anal itching, and fatigue. Giardia is one that you may have heard of. This is one that you hear a lot about when people are hiking and they're drinking water from, a fresh stream or something like that, and there could be Giardia in it. So this is associated with poor sanitation or contact with human waste that's been contaminated or animal waste, and then consuming contaminated water, as I said. And a lot of times that's from a stream or a lake or somewhere where somebody's drinking that water and it's contaminated with the organism. So again, similar symptoms as before, watery diarrhea, abdominal pain. This one has both nausea and vomiting and bloating. And so this is one that we can see somewhat commonly. Entamoeba histolytica. This is also associated with drinking contaminated water, and it's usually due to poor sanitation techniques or habits. And it's seen more in non-industrialized countries. We'll usually get this through travel history of our client. It's seen more in tropical areas than cooler areas. So this actually can be something that is asymptomatic. It's not a problem for the person at all. So again, there's that. Everything is not necessarily detrimental to the host. Earlier on, if you are going to have symptoms, it's going to tend to be loose stools and diarrhea and mild cramping. However, it can progress to a more watery, bloody diarrhea and severe cramping. And this is the term you've probably heard doctors talk about called dysentery. So that's when it's the more severe abdominal discomfort and diarrhea. If it's not dealt with and it is an infection that's actually progressing, it can lead to liver abscess, pleuropulmonary abscesses, which means that's in the tissue of the lung and kind of lining the cavity of your chest. It can also be linked with brain abscess and necrotic lesions in the perianal area, so like the anus area and your genitalia. Now, with this said, this is not, the most common presentation, and I don't want people to be nervous that if they see this on a stool analysis with their functional medicine provider, that this is guaranteed. It absolutely is not. It's just, if we see it and you're symptomatic, this is something we would address. So getting back to evaluation of these kind of more common organisms I just spoke to, we have the ovum parasite microscopy, which I mentioned. And that generally is part of a whole functional stool analysis that we will order. And so that's one of the things that will be reported to us. And that's, again, looking for live eggs and parasites. And as I mentioned before, if you just go to a conventional lab, you can miss these organisms because you can see them in a more dormant stage of life. Or if the person is not used to seeing them, then they can miss them, both the eggs and the parasite. So this is one that can lead to high false negatives. So you can miss the organisms either because they're dormant, they're not in an active stage of their development. And so it can look like they're not there. And then you can say there's no organism growing. So that's why a conventional stool analysis is not always the best bet. It's not bad if you catch it on a conventional test, then very helpful. But if you're symptomatic and still having symptoms, then you definitely want to be thinking about getting a 3-day functional stool analysis, which we'll talk about in a little bit. And as I was saying, if the lab does not see a high volume of O&P stool specimens, they're more likely to not catch it because they won't see subtle changes. We do this in patients also who are actually seeing worms because it actually will, through the microscope, be able potentially to visualize worms in stool. So this is something you definitely would do if someone reports that they've seen worms in their stool. Getting more into the evaluation for intestinal parasites, I mentioned the O&P. EIA stands for ELISA immunoassay, and this typically is one we're really looking at when we're looking for Giardia, Cryptosporidium, or E. histolytica. And this is often, in addition to the O&P, it's actually assessing for substances that it can actually pick up that the organisms are producing. So it's a second modality, a second way of looking for clues that one of these organisms is present and causing an issue potentially. Another modality that generally is going to be included on a really good functional stool analysis is PCR, which stands for polymerase chain reaction. And again, this is going to evaluate for even more organisms, which you can see here. And this is actually looking for the DNA of the parasite. So a third way that we can assess if something is present in the stool. And this is really helpful because it's actually able to pick up a parasite in both dormant and active phases of its development. So if you have an organism that it's not in the more active phase and you miss it on a stool analysis with O&P, this would be helpful because you could pick it up through the DNA. So the key here that I want to leave you with is that combining these modalities is going to be the most helpful way to really assess for a parasite being present. All right, this is a big one in the functional medicine world. Do we treat blastocystis or not? The reason that this is a conversation is that not everyone that is found to have blastocystis hominis in their stool is necessarily going to be symptomatic, and it may never lead to actual disease. And studies are kind of looking at this now and reveal that some people are symptomatic. And what is being speculated is that it may be that different subtypes have different levels of pathogenicity. And what that means is, remember I said there are 17 subtypes of blastocystis, which means there are 17 different types of the organism, which some of them may actually be more prone to actually causing disease than others. And so now what's being asserted is it's potentially different subtypes are actually causing a problem versus others. Your functional medicine provider is definitely going to do a good history or obtain a history from you and then do an exam, as well as get all of these tests in context to figure out whether treating blastocystis is appropriate. Generally speaking, a provider is going to treat it if you have symptomatic disease that lines up with one of these parasitic infections. So how do we actually even figure out? How do we even collect the stool to even figure out to get these tests? So the first thing that I would say is always get a 3-day stool sample for your functional stool analysis if you think that you have a parasite, because the more specimens that you have that you collect over time, the higher the probability is you're actually going to be able to pick up either ova or parasite. The next thing is that your doctor is going to tell you before this test to hold these different medications, because they potentially are going to interfere with, not just with the analysis it's looking specifically for parasites, but it's going to change your natural distribution of the organisms that are down there for your functional medicine doctor to be able to determine, do you have the key organisms you need to support your immune system to overcome an issue? Do you digest your food well? Do you absorb well? Are there signs of a leaky gut? Do you have signs of an allergic response in the gut? All of these things are very key, even when we're dealing with a parasite, because you can't just treat the parasite. You actually have to shore up any holes in the digestive tract, because 70-80% of your immune system is down there. And the more that we get that whole GI tract healthy by supporting digestion, absorption, the integrity of the mucosa in the bowel, all of that will help to lead to a healthier immune response, so that it's not something that your body has to keep dealing with either immune or GI issues. So for that reason, we need all of these things out so we can really assess the health of your microbiome and your GI tract without any interference. So when we're treating intestinal parasites as a functional medicine provider, it's always going to be tailored specifically to what you're telling us based on your history. So that's your travel history, exposures to people who also could have been infected. We're going to be asking about signs and symptoms of disease. We want to know your immune system status, your gut status. So we'll be asking you a lot in all of those areas. So it'll be specific to that, but also looking at your functional stool analysis. And the reason I said it's so important to do that functional stool analysis as it's instructed, taking out any medications, probiotics, antibiotics, etc., is because we want to see what is your microbiome / immune system doing in order to support your immune system or not support your immune system. Because the more that we heal that, that's going to provide more of a lasting response to any external exposure you have to a pathogen or any health challenge to your immune system and digestive tract. So that'll be tailored to all of that. The next thing that we're going to do when we're treating is we're going to have you follow the 5R program. You've probably heard this spoken about many times with a functional medicine provider. So that's your 5 R's. So you're first going to remove anything that's irritating. That includes, one, the pathogens, so treating the pathogens, which we'll get specifically to in a minute. But it's also going to be removing anything that's irritating to your digestive tract and your immune system. So that could be possible food allergies, wheat, dairy, sugar, alcohol, but anything that could be supporting an immune or inflammatory response, we want to pull that out through this healing stage so that we have a better chance of actually healing the gut, so you have a long-lasting immune response and digestive healing of the digestive tract. The next phase of the 5R program is going to be replacing things. So that's replacing things that actually support digestion, like digestive enzymes if we see you're not digesting well. If you're not specifically digesting protein well, we might add something called beta-HCl to help you break down protein better. But we're looking to replace anything that's actually going to support the digestive process more so that you're actually going to absorb and utilize those nutrients better. So that's the second phase of the 5R program. The third phase is going to be to re-inoculate. And that's when your provider looks again at what's growing in your microbiome, which will be seen on the functional stool analysis. And they're going to look at, do you have enough of the good guys? Do you have plenty of lactobacillus? Do you have plenty of bifidobacterium? They'll also likely look at the balance between something called Bacteroides and Firmicutes, because that is really important for a lot of different reasons. But they'll look at what's growing and suggest a specific probiotic blend to support your own microbiome and thriving. And then it sometimes is going to be pretty targeted if you have other things going on, like from a metabolic standpoint, like insulin resistance, etc. So that also will be tailored. Additionally, what a lot of us functional medicine doctors are going to do is try to start having you eat a diet that's actually going to support your microbiome so that we don't have to have you on probiotics all the time. So that would be like fermented foods. So eating that 2 to 3 times a day, like a kimchi, a fermented cabbage, fermented pickles, real pickles, not just the ones that sit on the shelf. So that's a key thing that we'll have you do. Plus eating the full color rainbow of healthy fruits and vegetables, because those are going to contain fiber and prebiotics, which actually feed the good guys that you want to be thrive to support your digestive system and immune response. And then additionally, sometimes we'll add something called short-chain fatty acids, like butyrate, which could be found in ghee. You could actually take a butyrate supplement, but a lot of us are going to try to use food first. So that is helping to re-inoculate so that what's growing your microbiome is more supportive of healthy immune and digestive health versus the more weakened immune response. So that's re-inoculate. The fourth stage of the 5R or phase of the 5R program is to repair that tissue, the lining, the mucosa that's in the GI tract. So they're meant to be little gaps in between the cells of the GI tract over time with different medications, and so birth control, anti-inflammatory, steroids, and just stress and certain food itself can open these up and cause a leaky gut. And that's problematic because it overstimulates your immune response and causes a lot of other issues. So the fourth phase is focused on repairing any issues that we see, whether it's leaky gut or what a functional medicine provider will call increased intestinal permeability, but we'll also focus on cooling any inflammation down in the gut. Sometimes we're going to use things like glutamine, fish oil, vitamin D, zinc carnosine, which is very healing for the mucosa, aloe vera. So there are a lot of options that your functional medicine provider will tailor to you to repair that mucosa, the GI tract, that's going to support a healthier immune and gut response. And then the last phase of the 5R program, which is really key and underappreciated, is called the rebalance phase. I actually, with my clients, really focus on this first because I think that it's very difficult to have someone heal their gut when they're over here in fight or flight. So I've got to get you to get over here to rest and restore with a healing process, and detox systems and reparative responses are actually turned on. So I really focus with my clients on getting in some meditation in the morning, in the evening, being in nature, anything that's very restorative to you that takes you out of that fight or flight response is going to be very supportive in getting you more into a healing mode. So your doctor will spend or your provider will spend a good amount of time in focusing on the 5 R's, because this is key to actually, once we've actually cleared the parasite, keeping other pathogens that could potentially be a problem, keeping them at bay. So very important. Don't bypass that. Now, to get into treatment, I put some of the more common strategies for intestinal parasites in terms of medications here, but we're going to get into the specifics now. So here are the parasite-specific treatments right here. And so let's go one by one. So If you have E. histolytica, the main way that we would treat that is to use flagyl or metronidazole, and your doctor's going to prescribe it 3 times a day for 10 days, and oftentimes going to add iodinoqual, 650 milligrams 3 times a day for 20 days. And so one thing that I'll say about this is a medication. You have to be off alcohol. Ideally, when we're doing any gut work, we're going to want you on off alcohol anyway, because that impacts your microbiome. So next, if we found cryptosporidium on your functional stool analysis, typically Alinea is going to be used for 14 days. Same thing for Giardia, Alinea, or flagyl or metronidazole can be utilized if this is not preferred. For Blastocystis hominis, again, that's if you're symptomatic. Then we would treat either with flagyl or Alinea. These are less common parasites that can be seen on your functional stool analysis, but I wanted to include them so that if you had kind of the regimen. They're not so rare that I don't need to include them, but there are actually different medications that are utilized for each organism. And this one here is actually a worm itself, so talk about that more in a second. So I do want you to be aware that typically, a functional medicine provider is going to want to start with a medication if you're having a lot of systemic or GI symptoms, because we want to get on top of it. However, sometimes there will be a reason to start with an herbal blend, whether that's because it's patient preference or there's a reason that we can't utilize a given medication. And usually it's going to be a blend of a combination of these oils. So if we use black walnut oil, you just have to be aware that it's not something we want to utilize in someone who has a tree nut allergy. Golden seal is another one that is very helpful for addressing parasites as well as a lot of other immune system things. Artemisia is Chinese wormwood. This rarely can be hepatotoxic. So we typically are not going to use this in someone who either is on a lot of meds that impact the liver. And just be aware that there is a rare chance of hepatotoxicity, which is liver injury. And we don't generally see that a lot, but it is possible. And then oregano oil, this is a big one that's used in the GI tract. This is one you don't want to use in someone who's got gastritis because it could further irritate that, but it's a really potent antimicrobial. And then lastly, thyme oil also can be utilized. So your doctor typically is going to look at the organism and then tailor a regimen specific to what they found on your functional stool analysis. All right, helminths, just a quick word about them. We saw about the tapeworm, which is a helminth. Your doctor's going to utilize one of these medicines or combination to address a tapeworm. It's a little bit different than the other parasites in that generally you're going to start with one dose and then repeat a second dose 2 weeks later. The thing that is really important with the worms, though, is that we really are going to want to repeat a stool analysis to make sure that it's cleared. The other thing that I would say about the worms is that if we see a recurrence of the worm infection or multiple members of the household also have an infection, then generally a good measure that the provider is going to recommend is to treat the whole household. So what are the next steps? So typically the symptoms generally are going to resolve, and we're going to advise you to continue to work on that 5-hour program with a healthy diet. And a lot of times we won't retest if it's something that's more straightforward and simple. However, if there are any ongoing symptoms, we for sure are going to repeat. But generally, a doctor is not going to retest that early on because we need to see other changes in the microbiome with you doing the 5-hour program. But a lot of times we will retest to make sure the parasite has cleared, particularly if the symptoms are not clearing. However, if you're still symptomatic or you have a recurrence and we've taken you through the treatment for the specific parasite and you've done the 5-hour program, we'll retest. If we find that you're positive, we're probably going to change the regimen. So the best thing to do is when you're going to follow up with your functional medicine provider after you've completed the recommended medication or herbal regimen to treat the specific parasite or parasites, you've done the 5-hour program, at least in part, because sometimes your doctor's going to have you do that longer term, depending what they have seen on your functional stool analysis and heard through history. But once you've kind of gotten through a good bit of that and you follow up with your functional medicine provider, go back to those list of symptoms that we spoke about initially to see, do you still have lingering joint pain? How is the anxiety? Is your digestive tract moving well? Do you tend to have better sleep? because once that GI tract is shored up, because it's a lot of the neurotransmitters that govern mood, sleep, etc., are actually made in the gut, the healthier and healthier you get that, you should see a lot of those other symptoms, which are not necessarily related specifically in most people's minds to the GI tract, they should be getting better. So that's a key indication. If that joint pain's not getting better, your brain is not feeling well, meaning no brain fog, things of that sort. If you're having lingering sleep issues, it could be other things for sure, but just make sure you loop back on all the symptoms that you were having to make sure that you are actually improving, because that will help your provider to know whether you need to go ahead and test further. Sometimes we'll add herbs to that as well after that. So we'll kind of do different cycles of treatment. Typically, though, it should be able to be cleared with treatment. So this was just an overview on how to look at and to assess for intestinal parasites, things to be out on the lookout for, and how to make sure that you can speak to your provider in a way that they're even looking and thinking about a parasite. So I hope this has been helpful in helping you to understand intestinal parasites and how your functional medicine provider can help you to assess for the presence of them and how to strategize or think about addressing them if there is anything present. So thanks for listening and be well.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.